Hey everybody, Dr. Dave Marquis here, and I wanted to talk to you today about synergy in nutrition. This is a topic that's come to my mind more recently as I'm looking through patients' labs and I'm seeing that there's imbalances, and they're also symptomatic relative to those imbalances, and many times it's associated with some type of micronutrient shift that they have been creating themselves. And so I'll start to talk to the patient and I'll say, so are you taking volumes of B6? Or are you taking high volumes of zinc? Or are you taking a ton of vitamin A? And they're like, well, yeah, I am. And so then I'll ask them, well, why? Why are you doing that? And they'll tell me, well, I was taking the zinc because I was trying to fight an infection. And for many people over the last 3 years, fighting different infections that we were all dealing with, many people were taking volumes of zinc along with quercetin, and for good reason. But what that does is, because there's a synergy in terms of zinc and then another cation called copper, it's another mineral, and if you're taking high volumes of one, you actually start to deplete the other. And so many of these patients were coming in, those that were taking high volumes of zinc, they were copper depleted. For example, on the vitamin A individual that might be taking volumes of that because they wanted to clear their skin, I'd start to see that their liver enzymes were starting to increase, and they were actually impacting this giant organ of detoxification in an adverse way. And this is true of every single micronutrient. There's always a balance. It's kind of represented in most areas of life as well, where there's a balance in all things. Many companies have tried to solve this conundrum for people by creating multivitamins. And they say, well, you know what, we'll just make it simple for you. Let's just put everything in an appropriate ratio that would be generally accepted as safe and run with that. And sometimes that's useful for some people until it's not. So there's this really interesting issue that people get into when they're trying to figure out, well, what do I take? I want to make it simple for myself. I don't want to become a master nutritionist. I don't want to have a gajillion bottles laid out. What is simple? And this is really frustrating. For each individual, it can be different. And so I'm not actually giving you an answer right there. Oh yeah, here, take this, because it's not that simple. Everybody has different needs. Everybody comes to the table with their own unique set of genetics where they might burn more of one micronutrient to the deficiency of the other, and they need to be aware of that. So I guess the thing that I'm sharing with you is self-awareness, and that as you go through this journey called life, hopefully you start to become a little bit more introspective and have the capacity to feel and understand a little bit about what your body's needs are. When I look at relationships with different individuals, oftentimes there's one individual in a couple that is like hypersensitive and they're super aware of themselves, and then the partner to that individual might have kind of checked out because they've outsourced all of their awareness to their partner and they just rely on them. Here, set out for me what I'm supposed to take and I'll just swallow it. I can't tell you how many times I hear that in spousal relationships where one person has completely turned their brain off in self-awareness and they said, I got other stuff to do. You figure out what I'm supposed to take and I'll just do it. That can work, but sometimes it doesn't. And this is why I really encourage people to get basic labs on themselves so that they can actually see what their micronutrient balances are. One of my favorite tests for that is called a micronutrient panel, where it shows everything that went in your mouth should show up in your serum. If you're able to metabolize those things that are in your serum, they should show up in roughly equal proportions, so it's balanced in your red and white blood cells. So in other words, you're seeing the intake and the outtake. I love those tests because it helps me to get an idea of where an individual's glaring overages are, where their deficiencies are, and where their bioconversion issues are. And it opens a dialogue where we can say, okay, it looks like you need to focus a little bit more in this camp, and let's figure out what you were doing to create that imbalance. And generally, it gets resolved pretty quickly. Taking that one step further, sometimes we'll find what works for us for a period of time, and then suddenly it doesn't. And it's so frustrating for people where they're like, I can't believe how good I feel. And they're going for like maybe 3 months of feeling great, and then they kind of plateau, and then they start to actually go the other direction. And they're like, what happened? What changed? Well, this is seasons of life, and this is demand and supply and demand. You're putting it in, you meet your body's demand, and then over time you gradually start to exceed what you need, and now it actually becomes a burden to the body. So this is where I really like to have people take supplement breaks. You wouldn't eat the same thing day in and day out 24/7 repetitively. If you do, you're invariably going to develop an intolerance to something that you're consuming repeatedly. And there's a similar phenomenon when we take supplementation. That needs to be taken into consideration, that we don't need the same thing every single day, except for a few. Water, we need every day. Fiber, we need every day. Outside of that, it's going to come down to what your unique physical demands are on your body that dictate the need. There are some common things depending geographically where you live. Most people are going to need a vitamin D, and if you're going to take a vitamin D, you really need to balance it with a vitamin K. Those two fat-soluble micronutrients really work synergistically to keep your blood vessels pliable and to help move your minerals where they're supposed to go in the body. If you're going to take a zinc for a high level for a period of time with an infection, you might think about having a very small proportionate amount of copper on hand to correct the inherent imbalance that you're going to create by taking the volumes of zinc, or just give yourself enough time away from zinc so that your body can recalibrate itself. Oftentimes, depending on how long you've been taking a high load for, it might take a month or two. Without doing blood testing to actually measure the exact amount, sometimes just giving your body time away from the high volume of things that you were taking is the necessary challenge. And the body, in its own innate wisdom, has the capacity to start to reset itself. You can't really do that for water. You can't really do that for fiber. I mean, these are some of the staples, so you can't stop putting those in. But for most of our micronutrients, we can. I want you to also think about the categories that micronutrients come in, and there are generally two classes. You've got the fat-soluble, and then you've got the water-soluble. The fat-soluble nutrients, A, E, D, K, choline, inositol, B6, and generally thought of as your fish oils or the EPA, DPA, DHA family, those all last longer in the body than the water-solubles. They generally are going to stick around for a week to 10 days after you've consumed them, particularly in high volume, so it might take a longer hiatus to allow those to recalibrate. The water solubles, just as they sound, they're going to wash through you pretty quickly. And this is most of your B vitamins, it's most of your minerals, which is why we generally have a higher need for those. Some of the interesting things that I'll see with like the B vitamins in particular is that there's even a synergy there. Some people who are taking high volumes of B12 and folate, for example, to the exclusion of B1, 2, and 3, so thiamine, niacin, and riboflavin, or backwards there, riboflavin and niacinamide, those will actually act as a gas and a brake pedal to our emotions. So I've seen many people where they do something called hypermethylate, where they take B12 and folate and they get too much of it and they get a little edgy, or maybe a little bit emotionally unstable. And they need to bring that down by getting in the B1, 2, and 3, or vice versa. Knowing you and your body's needs will help to dictate what you need to take, if anything. And it's rarely the same thing or same volume every single day. I really like to have people get an idea of those nutrients that are going to be most impactful for them, and then figure out a plan on pulsing it so that they have their week laid out and their month laid out, and they say, okay, Saturday and Sunday I'm taking a supplement break. I'm not taking anything on those days. Monday, Wednesday, Friday I'm doing these. Tuesday, Thursday, Saturday, or Tuesday, Thursday I'm going to do these. And so you start to lay out a routine for yourself, and then it does become simple. But realize that as seasons go and as your body changes and as the stressors on you change, you also need to look at changing your supply of what's going into the body. Just as you would change your oil out on your car, or you need to put gas in more frequently if you're going on a long drive. Our body has those same types of changing demands, and you just need to be aware of that. I hope that this was helpful for you, that you get an idea that micronutrient supplementation is very important, but it also needs to be understood and not get into this mindless routine of just taking and taking and taking, because it can be counterproductive for us when we get into that state. I hope that's helpful, and I wish you all to be well.